Double vision. Sharp pain every time the eye moves sideways. The surgeons expect scar tissue. Swelling. Maybe a trapped nerve. What they actually find on the scan is a tooth. A full tooth, sitting inside the eye socket. Weeks earlier, this patient had come through the ER with a face broken in multiple places. The kind of panfacial trauma surgeons see after a serious car crash or a hard fall. The jaw was wired, the cheekbone rebuilt, the swelling finally went down. On paper, recovery was going fine. Then came the headaches behind one eye, and every time they looked to the side, it hurt. At first, nobody connects it to the tooth that had gone missing in the crash. In trauma this severe, losing a tooth or two isn't unusual. It happens, it gets noted, and everyone assumes it was lost at the scene or swallowed. Weeks pass. The vision problem doesn't go away. If anything, it gets worse. Moving the eye upward or outward becomes genuinely painful. The ophthalmology team runs through the usual suspects: nerve damage, scar tissue pulling on the muscle, leftover swelling around the orbit. None of it quite fits. So they go back to the imaging. Not the fracture, not the jaw, the orbit itself. And that's where everything changes. On the CT scan, sitting right at the floor of the eye socket, is a dense, tooth-shaped structure. Not bone, not scar tissue, an actual maxillary lateral incisor, one of the upper front teeth, that had been knocked loose during the original injury and driven up through the fracture lines into the space just beneath the eyeball. It had been sitting there the whole time, quietly irritating the muscles that move the eye. This exact case was published in 2025 in the journal Oral and Maxillofacial Surgery Cases by surgeons Caroline Cray and Alexander Lin, a craniofacial specialist at UCSF. Here's what makes it so rare. Doctors already know that in severe facial trauma, a missing tooth is a red flag, because it can end up in the maxillary sinus, the nasal cavity, even the airway or the stomach. The eye socket was never on that list. This case put it there. That is not a small risk. The orbit is a tightly packed space. Optic nerve, eye muscles, blood vessels, all within a few centimeters of each other. A foreign object sitting in there for weeks can mean chronic pain, restricted eye movement that never fully resolves, or, in a worst-case scenario, damage that threatens vision permanently. Once the tooth was identified, it could finally be surgically removed from the orbit. But the real takeaway isn't the surgery, it's the miss. A tooth small enough to slip past the first scan, hiding in one of the most delicate parts of the human skull. The message this case leaves for every trauma team reading it: if a tooth is unaccounted for after facial trauma, don't assume it's gone. Find it, because it might not have left the building.